and it's the interviewee is Parviz Mehri, MD, and the interviewer is Mary Shah. The videographer is Amanda Wallace, and Amanda Wallace will also be doing the editing. Today is May 9th, 2018. The time is 10 o'clock. This is a conference room at Danbury Hospital. And the biography of Dr. Mehri is what I've been able to discern. After receiving his medical degree from Washington University School of Medicine in 1956, Dr. Mehri interned at Barnes Hospital. After he served as resident in medicine at the Manhattan Eye and Ear Hospital in New York City. Dr. Mehri spent a year doing research in pharmacology at the State University of New York. He studied the effect of medications used in the treatment of glaucoma. Dr. Mehri is certified by the American Board of Ophthalmology and is a diplomat in the American Academy of Ophthalmology. He is also an affiliate of the Royal Society of Medicine in England. Dr. Mehri served on the professional staff of the Albert Einstein School of Medicine for 17 years, and he is a fellow of the American College of Surgeons and the International College of Surgeons. This is an interview for the Danbury Hospital Oral History Project. The interview is with Dr. Parviz Mehri and is taking place at Danbury Hospital in Danbury, Connecticut. Today is Wednesday, May 9th, 2018. I'm talking with Dr. Parviz Mehri, who has been affiliated with Danbury Hospital since what year?
1963.
1963, so 54 years.
55 years.
Yeah. Dr. Mehri, can we start with some background information prior to your arrival in Danbury? Can you briefly begin with your childhood? Where were you born?
I was born in Ahvaz, Ahvaz, Iran, in southern Iran, which is very similar to Texas. It's an oil country.
Oh, yeah. And
it's on the Persian Gulf.
Okay. And did you attend grade school there as well?
I attended school, primary school, high school there, and also at the high-end Alborz College in Tehran, which is the capital city.
Right, right. And your family moved to the United States?
No, I did as a student.
Okay.
And attended Louisiana State University, and they gave me a bachelor's degree in 2 years' time.
Oh, congratulations.
In view of my solid academic background at Alborz College in Tehran.
Oh, yeah. And can you tell us more about what you studied in your bachelor's degree? Did you study biology?
Yes, biology and chemistry as pre-med. And then I attended Washington University School of Medicine in St. Louis. And I was one of the youngest to ever graduate at the age of 25.
Oh my goodness. And what were your favorite subjects in medical school?
In medical school, biochemistry.
Oh, really? And for your undergraduate, your favorite degrees? Or your favorite subjects?
Well, it was biology.
Okay.
General.
And did you do any activities outside of?
Outside of medicine.
I guess I understand ping pong. Okay. And is there anything that you'd like to share about your internship at all? Anything interesting happened at that point?
Well, I was at Barnes Hospital as a medical intern, so we were exposed with a tremendous amount of illnesses in young people, old people, young people dying from nephritis, and old people from cardiac problems. So at that time, ophthalmology was a side issue. How I got involved in ophthalmology is beyond me, because all my exposure in internal medicine was to general condition.
So you don't remember what set you on the path of ophthalmology at all?
I must say I was undecided. So one day, I was only 22 years old.
Mm-hmm.
I went to the eye clinic and I liked it because it was clean, it had beautiful equipment. And this is before I even started with training in ophthalmology. I
Right.
wrote my first prescription for bifocal glasses, and I remember the prescription. It was Plano and +2.
Oh my goodness.
I was 22 years old. That's how long I've been involved with
Yeah.
eyes. I've been very happy for my choice.
And how did you come to find Danbury?
That is truly intriguing because I was the chief resident at Manhattan Eye, and the eye bank was housed in the building of Manhattan Eye, and it was my job as the chief resident to collect eyes. But of course that meant in Manhattan or Brooklyn or Bronx. That's what I did all the time.
Mm.
It was 3 in the morning that a call came, Danbury, Connecticut calling. I had never heard of Danbury. So I got on the road and 684 wasn't built yet. So it took me forever to find Danbury.
Right.
By the time I made it to Danbury, it was 5 in the morning. So they showed me, the hospital was only this brick part at the time.
Right, right.
And they showed me the place, and as I was removing eyes to put in jars to take to the eye bank, the nurses hovered over me and said, "Dr. Mehri, come to Danbury, we need you as an ophthalmologist here." So I was thinking, and they were right. The moment I opened, the day I opened my office, before I opened the door, there were 13 patients waiting outside of the door for me.
Oh my goodness. So, do you remember the name of the nurse at all, or
No,
was it just
there were like 3 of them.
Oh yeah.
Before I got going with patients, a cowboy in New Milford was hit by the tail of a cow, and the eye perforated.
Oh my word.
So I called my chief resident for an opinion. He drove all the way from Manhattan to help me. He took a look and said, this cannot be repaired. You need a cornea. So the chief anesthesiologist at New Milford Hospital drove all the way to the eye bank at Manhattan area, brought an eye to New Milford Hospital, and I did a freehand peripheral corneal transplant. Because I couldn't use a trephine, it wasn't in the center,
Right.
it was in the periphery.
Oh my goodness.
So the moment I did that, my name got out throughout the state of Connecticut. I even had patients from Hartford coming over,
Wow.
over to see me. So I started with a cowboy scene in my practice.
Who'd have thought? I never knew that there were cowboys in your mouth.
I know, in those days they did, I guess
Yeah.
that was half a century ago.
Yeah. No, it's
Yeah.
understandable.
It seems like, a lot of your life is determined by powers that are not under your control.
Mm.
I had never heard of that until 3 in the morning.
Right, right. And so you raised a family here as well.
Yes, yes, yes.
Did you meet your wife in St. Louis?
In fact, no. While I was waiting to get going as a resident at Danbury Hospital at Manhattan Eye, I took a break and I went to Tehran, place of Tehran, Iran, country of my birth.
Right, right.
And
The
I didn't
capital.
know anyone. Yeah, that's the capital city. I
Right.
didn't know anyone. So I had to meet someone. I didn't know what to do. So I said, I'll go to the American consulate. Maybe they'll know someone.
Okay.
So I went to the consulate, and this very fine young American boy was the consul. He said, hello, let's go across the street for lunch, and he took me under his wings. And as I walked in, I noticed there was a pretty lady at the receptionist at his desk. So when we finished lunch, I came over and happened going in for a dance on Saturday night.
Yeah.
There was an American banquet hall. So I took her there, and then we took her on some more, and that's how I proposed to her. And after that, I realized that she was persona non grata, because when she was at American University of Beirut, she had spoken up against the king, against the Shah.
Right.
So she could not travel. So I went to the American embassy in Tehran, and I swore for her and signed for her, but she had to wait a whole year.
Mm.
So she was, I said a year is too much, I can't wait a year. So I said to her, fly to Canada and I'll drive you down to US, no one will know the difference. So she flew to Toronto, and I said, just take the bus to Niagara Falls and walk over the bridge. So she did. So she entered US illegally. She just walked over from Canada.
Well,
So-
I think things were a little bit more relaxed in those days.
So she came over, and she was just walking around like this. And she said, she stopped the guys. She said, "Sir, where is America?" The guy said, "Lady, you are in America."
Oh my goodness. Wow.
So I walked over and hugged her, and then it took a whole year for her official visa to arrive.
Oh my
So she
goodness.
was living here illegally for a whole year.
Wow. Well, I'm glad it all worked out. So what were your first impressions of Danbury when you first arrived in 1963?
Well, as you know, I found Danbury at 3 in the morning.
Right, so it was a little dark at the time, but after the sun rose,
And the city, I think it was much smaller, but I have to tell you, the hospital was 1/10 of what it is now. This
Right.
brick part that you see
right,
is the only part.
the center building and the north building.
Sorry,
The center building and the north building were the only two
there were, yeah.
that were here.
But anyway, just this brick part,
Yeah,
and then after that, the place became enormous.
yes.
In those days, actually, I went to Brewster as a possibility of, because I also have a New York license to practice.
Okay.
And they had only like a hall, maybe 4 times the size of this room, and just bed after bed after bed. Very dismal looking. But I went to Brewster a year ago. The hospital is enormous now.
Yeah, it is very big. It
You've been
is.
there, huh?
I think I have once or twice, so.
Looks as gorgeous as Danbury House.
Almost as
Almost.
gorgeous. So, could you talk a little bit about the changes that you've seen in the hospital? I mean, and when you first are in
Yes,
the
yes.
practice of medicine.
I have to tell you, tremendous. Of course, as you know, they had never done corneal transplant, so I introduced corneal transplantation. And in those days, for any operation, they would admit patients to the hospital and stay in the hospital 7 to 10 days.
Mm.
So I struggled to get 1-day surgery going. There was enormous opposition. I wrote Dr. Ed Maumeny, it's Maunee, Maumeny, the chief of ophthalmology at Johns Hopkins. And I said, I pray on my knees for you to write a note saying that cataract surgery can be done on an outpatient basis. Because those patients were kept for 7 to 10 days with eyes patched, and they were, of course, exposed to hospital infections.
Mm.
So he did write me.
Oh, good.
He wrote a note saying, yes, cataract surgery can be done on an outpatient basis. So that was the beginning of cataract surgery on an outpatient basis. And of course, I introduced microscopic surgery, so the chances of errors were minimal. The reason they had to keep, one of the reasons that they kept our patients in hospitals is that they did not use microscopes for surgery, so the stitching was not accurate. But I was doing microscopic surgery, for the microscopic cataract surgery and glaucoma surgery. So there was no need to keep patients in the hospital and expose them to all those hospital infections.
So back then also the patients would be kept in for days at a time for glaucoma as well?
For cataract, glaucoma, retina, any eye surgery, foolishly, they were keeping the patient for 7 to 10 days with patches on both eyes.
Wow. And so the
Can you
recovery.
imagine that? I'm surprised they didn't go crazy.
I
24 hours, 7 days.
I would have a hard time. I'm a
Yeah.
big reader, so I
But I
appreciate
had to
my
face tremendous opposition.
Mm.
Tremendous opposition.
And you got the letter from Hopkins, Johns
Yes.
Hopkins,
Dr. Momini.
and that helped